The deadline to extend the Affordable Care Act tax credit is quickly approaching in December. A pair of California congressmen from both sides of the aisle are actually proposing a framework to try to prevent health care costs from skyrocketing, or so they say. Joining me now, one of those men, Congressman Kevin Kiley. He's also on the Judiciary Committee as well. Congressman, great to see you. A little sound here. This is Caroline Leavitt talking about Obamacare. I want to play this and get your thoughts on the other side. As you know, the White House been very resistant to this idea of, let's just say, going beyond what the Democrats originally proposed. Listen to this.
I will tell you that healthcare is a topic of discussion that's happening very frequently and robustly inside the West Wing right now. The president's very much involved in these talks, and he's very focused on unveiling a healthcare proposal that will fix the system and will bring down costs for consumers.
And that is why we wanted to have you on the show. Can you help us fix the system, Congressman?
Yes, absolutely. And that's something that we need to do with urgency. I think that the recipe for doing so is reforms that control costs, options for consumers, and innovation that actually brings new drug discoveries and treatments to patients. But the immediate question that we face is this expiration of these tax credits that 22 million Americans rely upon. We're talking about independent contractors, small business owners and employees, retirees who are not yet eligible for Medicare, who are in a sense victims of this broken system. And if Congress fails to act in the next month, they're going to see their healthcare premium payments double. They're going to be paying thousands and thousands of dollars more. So the bipartisan bill that we've come forward with, which actually has been echoed in some ways by the White House, the main elements of it, does something very important. It extends this support for 2 years, but just 2 years. And at the same time, it institutes reforms. It cracks down on fraud and overpayment by insurers so that we actually pay for that 2-year extension. In other words, it's fiscally responsible and we don't increase the deficit or have to raise taxes in order to make it possible.
Look, but here's the problem. Waste, fraud, and abuse were rampant under the existing system. You have folks who are not even eligible or shouldn't be eligible in this country that are drawing from the system. And by the way, the original intent was to make sure that it would drive down costs. We've not seen that at all. It's this constancy of, here's the sales pitch, and then years later, it turns out now we have to keep putting more money after the problem. Do you understand the frustration some folks have, Congressman?
Oh, no, that's exactly right. The whole problem here is we have this vicious cycle where the cost of care continues to go up, so we subsidize it more, and then it goes up even more. So our proposal is designed to break that vicious cycle without victimizing 22 million Americans. And the way that we do that is we say, okay, let's provide some runway so we can tackle the broader issues that beleaguer our healthcare system in this country. So we can take on the healthcare affordability crisis. But we'll provide that runway with a temporary 2-year extension that is fiscally responsible and pays for itself in precisely the ways that you just mentioned, by cracking down on fraud, by stopping people who are not supposed to be enrolled from getting enrolled, by stopping overpayments to insurance companies, which has become a huge problem in a number of healthcare programs. And by doing all of those things, that cost of extending this for just 2 more years, it will actually be paid for. That's why it's fiscally responsible. That's why I partnered with Sam Liccardo, who's authoring this with me. He's a Democrat, but he believes in fiscal responsibility as well. And we've gotten quite a bit of bipartisan support for this, and the proposal that it looks like the White House is set to announce incorporates a lot of these elements as well.
Yeah, the White House seems to be really aggressively trying to unpack a way to help people without destroying the system, broadly speaking, because as you pointed out at the very outset, a lot of people are actually reliant on the system, and yet it didn't save a lot of people a lot of money. It's going to end up costing them a lot more if we don't do something. That seems to be the overall thought at the White House. Let me share this. This is the president talking about affordability. I thought this was interesting. Just want to share this for the audience and get your reaction. He says, because I've invoked favored nation status for the United States of America, drug prices are falling at levels never seen before, 500, 600, 700% and more. No other president has been able to do this, but I have. This is also the answer to much less expensive and far better health care. I am the affordability president. Tough to argue with that because that's really where a lot of the costs are, Congressman. That, and I think a lot of people agree with him. Give the money to the consumer and let them get out there and buy it. Your last thoughts, 30 seconds or so.
Yeah, I couldn't agree more. I think when it comes to controlling costs, we absolutely need to look at the cost of prescription drugs, at PBM reform, at these surprise bills that we get in hospitals, at fraud. And then we also need to give more options to consumers in the form of health savings accounts and association healthcare plans. And so I think those are the main principles that are guiding the White House on this. But Congress needs to take action. I think that failing to act here is simply not an option when people are being forced to pay so much already.
I think you nailed it. Congressman Kevin Colley, great to see you, my friend. Have a good weekend. We appreciate your time today.
You as well. Thank you.
Hey everyone, I'm Emily Campagno. Catch me and my co-hosts Harris Faulkner and Kaylee McEnany on Outnumbered every weekday at 12 p.m. Eastern, or set your DVR. Also, don't forget to subscribe to the Fox News YouTube page for daily highlights.